Hello and welcome to Aston Originals. Today we're talking about nutrition education and why there is a need for more health professionals to study diet and health during their degree courses. I'm joined by Dr. Duane Mellor and Dr. Hannah Bartlett to find out more about what the College of Health and Life Sciences are doing in this area and what more could be done. Firstly, could you introduce yourselves?
Hello, I'm Dr. Duane Mellor. I'm a senior lecturer in the medical school at Aston University. I'm also a dietitian, so I lead on teaching nutrition there, and also happen to be an associate dean within the College of Health and Life Sciences.
I'm Dr. Hannah Bartlett. I'm a reader in optometry and also Associate Pro Vice Chancellor for Diversity and Inclusion.
Lovely. Well, firstly, Duane, can you tell us more about the wider issue here of diet and health in society, and then obviously why it would be really useful to have this in the curriculum?
So if we look at our healthcare system, it's struggling now with the increasing burden of what we call chronic disease, some people call lifestyle diseases, non-communicable diseases, and a lot of them have factors contributing to them that are related to diet. So if you look at things like people living with obesity and overweight, that can lead to increased risk of things like high blood pressure, high cholesterol, which can lead on to things like heart disease. Also independently, being overweight, that can increase risk of type 2 diabetes. And I think it's around about 12, 13, 14 different cancers associated with higher body weight. So these are all linked to diet. So if we can help people to make healthier food choices and enjoy and stick with those healthy food choices, we can improve the health of the nation whilst also improving things like waiting times and access. Put that on top of the current situation we have where there's rising prices of foods, it's being able to give sensitive information which is culturally appropriate and culturally sensitive that people can work with, enjoy and fit into their family lives and their communities' lives.
Great. Now, looking at the education, the curriculum for nutrition that has been developed, could you sort of explain why it was needed at sort of undergraduate level? I understand there was some collaboration with some outside associations as well.
So it's unusual. I feel lucky to work at Aston University, because not many medical schools have dietitians working in them or nutritionists. Down in Sussex and up in Dundee, a couple of examples. But we've been working with a group called the Association for Nutrition who register and regulate as a voluntary basis nutritionists within the UK, and they took on a project which has evolved through things like the joint academies of medical bodies, and they've come together and they've pulled together in a joint working group people who from medics, things like gastroenterologists in practice, people like myself working in medical schools, dietitians and other people from the learning bodies to come together and develop a curriculum for medical students. Why is it needed? If you look at medical education, it's already very busy. It's a very intense degree. If you look at the clinical years when they're in the hospital placements, they're starting in August and finishing in July. There's a lot to learn. So it's about getting a curriculum that works with the General Medical Council who regulate medical programs and fits in there in a vertical way, so it builds on year on things they're learning. And if we actually look at what's stipulated by the General Medical Council, they already say that nutrition is important. You need to be able to monitor as a doctor if someone's underweight and vulnerable, and then be able to seek the appropriate help for that. You need to be able to understand how nutrition fits in there as a core biomedical science. That's the same biomedical science as things like anatomy, which we know is very important in medicine. We need to get nutrition in there as well. And then looking at how it fits in the social and psychological aspects. We mentioned the cost of living, how people afford and choose food. So it needs to be built in there. And we've put together a curriculum which hopefully aligns to that and builds on that in the areas of things like hydration, public health, as well as in sort of health and prevention nutrition.
So Aston's slightly ahead of the curve on this. We already have an established nutrition curriculum for the medical students. Can you just explain a bit more about what's happening at Aston and how we could go further with that?
So we're a new medical school at Aston, and it's great that we're going to have our first graduates of doctors going out next July, and we're really looking forward to that. And being from the beginning, you've been able to develop those aspects and sort of working, because it's a partner with Leicester Medical School who sort of look after our curriculum to make sure that our doctors are trained in the right way, is to build in from the very beginning. So when our students start with us, we talk about the importance of nutrition in settling into university. So if you know how to eat well and look after yourself, along with things like exercise, mindfulness, and those sort of aspects, you can actually study better and you're better prepared for the challenges that life throws ahead. And we go on from that early time in the first year to then look at how you can look after each other and sort of keep an eye on each other and get that supportive environment. And then sort of as we move through, that goes into things like the metabolism, how nutrients are digested and move through the body, and then into the sort of main part of my teaching, which is talking physiology of things like the stomach and the intestine and how that functions. We don't just do it from a theoretical point of view, it's embedded in their clinical skills teaching. And in the second year, we get them to talk about lifestyle change. So starting to use the aspects of how someone might want to change their diet, could be physical activity as well, to actually improve their health. And that's a good way, because having little conversation about could you think of, could you try this, is a good way of introducing those skills of inquiring with a patient how they can make changes. And we carry all this through, so it's not just taught, we assess on this as well. Because if you want students to fully engage with the material, they need to know they're going to be assessed on it, so then they'll be safe to then practice it later on.
Great. And as regards to other health professions that we have here at Aston, could you see this being rolled out there? And if so, how?
So that's something we've been looking at, because it's great at Aston. You know, from next year, we're going to have a nursing program, which is well on its way to be development. I've been talking to the team developing that course, how nutrition potentially could fit in there. And also, if we think Aston's been known for many years as a great place for training both sort of opticians and sort of eye health professionals, and also pharmacists. So in our optometry in our pharmacy school, starting to talk to the colleagues in there about how we can integrate that and looking to learn from what they've done already. That's why it's great to have Hannah here today to talk about some of the great stuff that Hannah's been involved in.
Yeah, absolutely. Thanks for joining us, Hannah. Could you tell us a bit about your research, which looks at nutrition and eye health?
Yes, of course. Well, my research started out by looking at the impact of diet and nutrition on the progression of eye disease, specifically age-related macular degeneration, which is the leading cause of visual impairment in older adults in the UK. Our team at Aston and other researchers were finding that there were certain nutrients, certain foods that could be helpful in delaying that progression or worsening of the condition. So we then went on to look at how aware patients were of that link between diet and their disease. And we worked quite closely with a charity called the Macular Society, and we talked to age-related macular disease patients to see what their understanding was of which foods were important and whether or not they were consuming those foods. So important foods are dark green leafy vegetables, for example, like kale and spinach. And we also asked them where they'd got that information from and how helpful they'd found that. And what we found was that patients generally weren't particularly aware of which foods were helpful, and they felt that they hadn't received that much information from their eye care professionals either. So that led us really then to work with eye care professionals to look at how we could support them in developing their practice, to understand which patients would benefit and what kind of advice regarding nutrition and diet would be helpful. And also to work more with patients to understand what they would need to empower them to have those useful conversations with eye care professionals to understand what would be best in terms of dietary advice for their particular circumstances.
I mean, that's really interesting about the research that you've done so far, and obviously looking at, the impact on patients and how they would receive that advice. Is there anything we can learn here about how patients would be communicated to when they're visiting the opticians, for example? How would you impart that advice when you've come for an eye appointment, but there might need to be some conversation around food and diet?
Well, feedback that we get from optometrists and other eye care professionals is that they sometimes don't feel too confident in talking to patients about their diet. And I think that's partly because perhaps they haven't had specific nutrition training in their undergraduate degree programmes, and also because those conversations can sometimes be quite difficult. Conversations about food and diet can be quite sensitive. And so we're really looking at how we can make sure that optometrists feel comfortable even just talking about the government guidelines around healthy eating, so the 5-a-day messaging, even to bring that into conversations with patients can be really useful in terms of opening up that conversation.
And I mean, as regards to the other health professional courses that we have at Aston, is it something that we're going to start implementing? How do you see that working?
So, it's great, and one of the reasons we're talking about this, because with the Association for Nutrition, led by Dr Glenn Jones, we've not just got the curriculum for medicine that was published last October, we've got a paper that's been published jointly in the British Journal of Nutrition and the BMJ Nutrition, Prevention and Health, which is looking at this idea of how we put the nutrition on the table, the curriculum table for medicine. And sort of working with the Association for Nutrition, we've started to explore of what it could look like for the professions. And we've sort of taken a different approach, and we started asking people sort of across the UK about what their thoughts would be, both in sort of those who might be teaching optometry or pharmacy or nursing, but also in some of those bodies around it, and to gather some of their thoughts. And it seems to be there's a consensus on some core things that they need to know. As you say about the dietary guidelines, we need to know how to communicate those. We need to know how to raise a topic of diets sort of in a sensitive way, and we can give advice on that. And then it's looking at sort of a little bit of what's in some common foods. I think that then ties to the healthy eating plate. And then there might be some specialist things that maybe a nurse working on a ward might want to know about, how to sort of support someone who's had a stroke with eating, which may not be as appropriate to someone working in sort of eye healthcare in optometry, in an optician as a practice, because there's different fields. So that's the sort of thing, and we're hoping to build on that and then develop some materials which can be shared and adapted across the different courses. And I think there's opportunities, the way a lot of our health courses are changing, bringing in some of the placements into the actually core degree, that we can change it, as well as it's great that we've got a nursing program starting. So we've got a lot of energy and a lot of chance to change and really adapt how we teach and give more of this lifestyle information in there, which includes diet.
And in practice, how do you see students sort of taking this up when they're training? Is it through their work placements, or is it in the classroom doing sort of potential role play situations, so that they can learn how to have a difficult conversation, for example?
I think that interprofessional learning that we can kind of facilitate at Aston is incredibly important, and it allows students to talk to and work with other students from other health professions, and to practice having those conversations and to understand how to personalise those conversations to make them more effective. And we do know that patients don't always retain all of the information that they receive in consultations with healthcare practitioners, and so anything that we can do to support our students in really making that delivery of information effective, I think is a positive step.
And as Hannah's saying, this idea of making every contact count. So it's got to be personalised. It's got to be something someone can identify with. We can have a little bit of a chat around some of the cultural aspects of food, which are really good to look at. But it's also looking at identifying those little prompts from people. So quite often in an eye care consultation, you'll ask about the food that they eat, and it's following that up with a simple question about, how do you feel about that? Or is there anything you consider changing about that? Or do you think that's good? Or what would you like to do? And it's that question, have you thought about? There's some things, and I think the other thing is we need to look at the idea of having conversation about food and nutrition related to health in the same way a lot of health professionals talk about smoking, because I'm sure smoking cessation is a big area of practice where food is a smaller one. But if we actually look at the cause, the effect of sort of diet in terms of disease risk, sort of
significant, isn't it?
Bigger
we
now
all
than
eat
smoking.
food. We're not all smokers. Yeah.
I think it's fair to say that certainly in the optometry profession, that optometrists would feel more confident talking about smoking cessation than they would about diet and nutrition intake. So I suppose it's just about, you know, changing that perspective and supporting students in developing those skills and that knowledge.
And I think the other thing who's interested in sort of eye care is a lot of the initial focus looking about lifestyle change is focused on the eye. And so your great work that you've done is starting on looking at macular degeneration type work. And it's actually looking, well, diet can actually do so much more. You know, because I guess a lot of people have an eye appointment because they might notice they're getting slightly long-sighted as they hit middle age. These are also the people that we need to work with to reduce their risk of type 2 diabetes and cardiovascular disease. So there's a great opportunity there that possibly more of the people who might be what you call at risk in the middle years might be visiting an optician that may actually go to be a GP, because generally they're quite well. So they don't feel they've got a health issue, but they notice that, you know, their arms aren't quite long enough for them to read the paper, so they can get their eyes checked.
Yeah, exactly. So it's just about optometrists taking that opportunity to have those conversations in terms of maintaining optimum health for as long as possible.
I mean, to me, it sounds like it's a really fundamental part of all healthcare professional training, having some education around nutrition, and so that it can be brought into practice. And what do you think needs to happen for it to be rolled out amongst, you know, all healthcare courses? I mean, obviously we're ahead of the curve at Aston, but what could happen for it to be rolled out, or how can it happen?
Yeah, when you read a lot about it, it says you need more people with nutrition backgrounds teaching these programs. I think that's limited because we need to actually understand the different subjects and support each of the subjects. I think that needs to happen more. So you need to have more conversations, a little bit like this, to understand the subjects and go like, well, I could help with that a little bit. And then there's a bit of sort of development, and you're almost trying to not take away the specialism, but you're trying to add to that specialism. So you've got a more integrated healthcare system, so health professionals work together rather than tend to work separately, which can happen. And I think Aston is also a great place because it's such a diverse institution. And I think you mentioned about sort of food being sort of something that people might not feel comfortable talking about, because there's issues about, am I talking about someone's weight when I'm talking about food? And that can be quite sensitive, but also about culture and heritage. And if we can encourage our students to be culturally sensitive and having conversations to explore each other's cultures, that then can work with patients, as you mentioned earlier, to have these individualized conversations that people tend to remember, that people understand me. They don't necessarily know who I am, but they understand me and are interested, and then can work with me to actually make suggestions that fit for me. And I think they're the two things. I think in terms of subject, Hannah mentioned it perfectly. We've got a basis of the Eat Well guide as a basis. You need a little bit of knowledge underneath, understanding what some of the bits and pieces do under there. So a little bit under the bonnet, not too much nutrition science, but building on the basic science that all our healthcare students will have. A lot of it is about the communication and giving confidence to have those conversations, and then knowing how to work as an interdisciplinary team, this interprofessional working, which again is something we're looking to promote as talking as different academics, students, and also in the learning, and then take that onto the workplace so people are happy to refer on and seek that advice and encourage their patients to sort of be confident in that.
Great. Well, thank you very much for joining us on Aston Originals. You can follow us on Twitter at Aston Originals. And if you're interested in any of the research mentioned today, you can find the links in the description.